Hi, I'm Jeff Bloomberg and I'm the Chief Operating Officer at MGE. And this week's tip is called 3 Ways to Improve New Patient Conversion. So when we talk about new patient conversion, what are we talking about? We're talking about turning an incoming call into a new patient who actually shows up in the office. And it's actually a real problem in the dental industry. Our friends at Viva Concepts did a very exhaustive study a couple years back where they listened to over 10,000 phone calls. And what they came up with is the average conversion rate for the average dental office. Obviously, some are higher and some are lower, but the average conversion rate is 23%. That means for every 100 new patient phone calls that you get, 23 become new patients if you are the average dental office. It's pretty staggering because if only 23 are becoming new patients, that means 77 are not. So this is obviously a big issue. So I wanted to take a look at 3 specific things that you can do, and this actually has to do a lot with your receptionist position to improve that conversion rate and start getting more new patients. So let's look at point 1. Point 1, I like to call rethinking the receptionist position. Now, beyond the fact, what do we already know about the receptionist? The receptionist is the first point of contact in your office for anybody calling, whether it's a business contact or a prospective new patient. Generally speaking, when a new person is hired in a dental office or the front desk, the first thing they're asked to do is answer the phone. Because why? It's easy to teach somebody how to say, "Thank you for calling ABC Dental. My name is Jeff. I can help you." That part's easy. What's hard is teaching them what to do once they've actually answered the phone, and here's a new patient asking, "Do you take my plan?" All right? So based on the data we went over a minute ago, 23% conversion rate, I want to give you another number. The average dental office in the United States gets 30 new patients a month. We're going to go back to that in a minute. And every new patient, on average, this is again the average, you might be higher, you might be lower, all right? The average new patient is worth $1,200 a year in their first year to a dental practice. These statistics, again, come thanks to Viva Concepts. So if the average practice is getting 30 new patients a month and they have an average conversion rate of 23% of phone calls, how does that work out? Well, if they're getting 30 new patients a month, what is 30 23% of? 130. So to get those 30 new patients, that means they're getting 130 phone calls. 30 convert, 100 don't. So now, what is that practice losing if they're at this average conversion rate of 23%? Well, they lost 100 prospective new patients. Times $1,200 a patient, that's $120,000 a year lost because of that conversion rate. So I say rethinking the receptionist position because, again, we've hired this new person. We're paying them $12 or $13 an hour. They don't know much about dentistry. We want them to answer the phone, but they could potentially, if they don't know what they're doing, I'm not saying they're a bad person, but they don't know what they're doing, they could be losing you hundreds of thousands of dollars per year. So you have to rethink this position. And by rethink it, what do I mean? Obviously, 1, don't go on the cheap. Get somebody who's got some skills. And number 2, even if you have somebody with some skills, that's not the first thing I would have them do. I mean, maybe they could answer the phone and pass it, but what would I have them do first? I'd train them to do something simpler while they learned how to convert these calls and have whoever's currently converting them continue to convert them while they get trained. I would not let somebody brand new loose on my prospective new patients because those prospective new patients, you're spending a lot of money to get. You know, what's something easy you could have them do? Have them do some reactivation calls. Generally, a patient of record is going to be a little bit more forgiving than somebody who's brand new and calling your office for the first time, and it's not hard to train somebody to call somebody in for a checkup. Then once they learn how to answer the phone and actually convert these new patient calls, then you can let them loose. But I wouldn't just hire somebody brand new, stick them on the phone, and allow them to proceed to lose you hundreds of thousands of dollars because they don't know what they're doing. That's point 1. Point 2 has to do with the attitude at reception. Now, I'm not obviously talking about a bad attitude. That's sort of a no-brainer. I'm talking about how the person is operating, specifically with relation to incoming communication. The receptionist sort of has a split personality. On the one hand, they have to be the gatekeeper so that you're not receiving sales calls all day long and they're not just passing them straight to you. Unless it's an MGE call, you should definitely take that. But on the other hand, you want them taking new patient calls and converting those. So they sort of have to flip between being the gatekeeper to being the person who's receiving. Well, let's take a look at the very definition of the word receptionist. It comes from the word receive, which comes from Latin, which means to take in or admit. So that is the flow you want the receptionist operating with, which is they're willing to take in communication from everywhere. They're completely comfortable and happy about it. They're not trying to stop it. All right. Now, once they've figured out who they're talking to, then they can act accordingly. So, it's welcoming rather, and friendly. Thank you for calling ABC Dental. This is Jeff. I can help you. Hey, this is Mr. Stockbroker. I'd like to talk to the doctor. I'm sorry, the doctor can't take your call right now. Can I take a message? All right. Well, all right. You want to get that one off the phone as quickly as possible. But that initial communication when the person called is nice and friendly and makes a nice first impression. Then we get to point 3, which is the quality of communication. A lot of receptionist training that I've seen at least focuses on the words to say. Always say yes, never say no. Always say word, this word or that word. And I think that starts to take a bit of the wrong focus. Another interesting statistic from our friends at Viva was that there's a direct ratio between the length of time your receptionist spends on the phone with a prospective new patient and the percentage that convert. What does that mean in the real world? It means, the longer they spend on the phone, the better chance they have of converting that new patient. So you don't want it to be a quick back and forth quick exchange. You want to actually build some quality communication with this incoming caller. And this is where I see things tend to go wrong. And what do I mean by this? So a person calls your office, hi, I'd like to know how much a crown costs, right? I'm sorry, we don't quote prices on the phone. Click. Well, that's a wasted opportunity, because what do you know? If a person's calling to find out how much you charge for a crown, they obviously know they need a crown. Someone told them they needed a crown. I doubt they diagnosed themselves in their own home mirror. So, and chances are they need more than one crown, because they're not going to probably change offices because of a $100 or $200 fee difference. They probably need multiple crowns. You see? So the idea at this point is you want your receptionist to actually build rapport and communication with the person that's calling in. You don't want them to just dead end the communication right away. So a receptionist who has difficulty communicating is going to have a real hard time doing this and converting prospective new patients. They have to be an excellent communicator, because this is a real person calling in with a real problem, and your receptionist needs to find out what this problem is. I mean, how might something like this go? Person calls in, hi, how much do you charge for a crown? Well, I can give you a price range, but do you mind if I ask you a few questions first? Sure. Well, first off, can I get your phone number and name in case we get disconnected? Okay, good, right? Well, does your tooth hurt, right? No. Did someone tell you you needed a crown? Yeah, my other doctor. Okay, that's fine. How many did they say that you needed? 2 or 3, or 3, let's say. All right, very good. Are they on the top or the bottom? They're all on the top, and they're left or the right. They're on the left and the right. Do any of them hurt right now? No. Are any sensitive to cold or hot? Yeah, when I drink hot coffee, the one on my right-hand side hurts. And those ask questions to actually establish communication with this person, because then the person calling in who has a real problem feels like they're talking to somebody who's actually friendly and can possibly help them. And this is where I always challenge anybody I'm training, for instance, on marketing. I challenge them to do this, is I want you to think like the person who is receiving your marketing. This is part of being a marketer, is you have to flip to the customer viewpoint for a second. Look at what appeals to you. So specifically, we're talking about the phones. I want you to take a look at experiences you've had where you've called a business and it was a good experience and a bad experience. What made it bad? What made it good? I can probably guess at what made it bad. The person was rude, the person was short, the person would not answer your questions, the communication was choppy. Well, that's what you don't want in your office. You see? You want it so that when the person calls in, they feel welcome, the person is friendly, and the person they're talking to doesn't sound rushed, and they're actually being interested and getting in communication with this prospective patient. That is something that I see that is wildly out. I start every seminar off that we do here at MGE with the fact that I've been to over 1,000 different dental and healthcare offices across the United States. I've seen all kinds of wild stuff out there, including the offices where you go in and the receptionist is virtually scaring patients away by how mean they are. Mean, nasty, not nice. I've seen it plenty of times. That's not the impression you want to create with patients, because again, remember, a first impression is built in a very short period of time. There's differing studies on it where it's built within 10 seconds, half a second, a minute, 30 seconds. Doesn't matter, it's not a long time. That first impression is what's going to last for the rest of the person's association with your business. So, Those are the three things you can do to improve conversion rate. Now, a couple other ideas I can give you is one, we do a lot of training on this on our online training platform, ddssuccess.com. You should check it out. There is training on phone skills as well as communication. And two, if you want to see this live, we do go over new patient conversions and receptionist training at our MGE New Patient Workshop, which we have a link below that you can click to find out when the next one's going to be near you. I hope this helps, and if you'd like to see more tips like this on a regular basis, don't forget to click the subscribe button, which I believe is below now. And if you have any questions about MGE, you can find us online at mgeonline.com or call us at 800-640-1140. Thank you.